Good afternoon, everyone, ladies and gentlemen. My name is Hao Kim Chuan. I'm professor in Faculty of Medicine in Utah. I'm also the founding president of Osseintegration Society of Malaysia, which is our Malaysian Implant Association. Right. Today, I'd like to share with you about digital and artificial intelligence technology on dental implants. Why do I share such a topic with you? This is actually initiated by a lot of patients who actually ask me, how is it possible that we could place implant nowadays within 5 minutes? And I like to share with you the technological and surgical background. First of all, when we want to place an implant, right, you have to actually satisfy 4 criteria. First and foremost, it's actually whether there is sufficient amount of bone and we call bone availability, the thickness as well as the length in all 3 dimensions. And how do we evaluate this thing is that by 3 things. First, our clinical evaluation, and second is actually by 2D X-ray, right? And the third one is by 3D cone beam CT scan, right? Which is also known as computerized tomography. Now, with this, it actually helps us to assess, number one, the bone thickness, bone density, bone hardness, and all the essential tissue, like, for example, our blood vessel as well as our nerve. And it also helps us to determine whether we require bone graft for the treatment. Then what's the second point? Second point is what we call it biologically designed implant system. Now, the implant system is very important, and the design of this implant actually has got 3 factors. One is a geometric design, whether it follows the root form of the biology. The second is that whether it's a digital design, whether it is actually fully compatible with the digital and AI technology, that we can actually from design until the final product is all in the full digital platform. And the third factor is actually whether it follow the bioengineering principle. What bioengineering principle is that? Number one, whether it can withstand heavy biting force. Number two, whether we can form a bacterial seal and virus seal connection such that there's no leakage. All right. So the third factor is about our periodontium. Okay, so we actually look into whether we have sufficient keratinized and attached gingiva. What it means is that our gum, whether it's thin, medium, or thick, and whether it is keratinized or non-keratinized. So this is a very important aspect in the long-term maintenance of the gingival health of the teeth as well as the implant. So last but not least, having satisfied the first 3 factors, then now our challenge is that how do we restore the implant such that it looks just like what Mother Nature has given us with a good aesthetic as well as function just like a natural teeth. And for this, we use a term called emergence profile. So what emergence profile means is that if I can show you this picture here, that this is the final outcome of the implant here, that you could see that you cannot differentiate that which is implant and which is the natural tooth. All right, so we go back to the chronology again. This patient actually presented with a very loose upper left central incisor, and he's actually facing a dilemma because the teeth is very shaky. He could not bite properly, but yet he didn't want to take it out because of the social so-called problem that is aesthetic, that he will have a missing teeth there. But when we have evaluated the whole condition, then we told him that we can actually do an immediate implantation. So what we did was that we extracted the tooth, and then we clean out the extraction site, the socket. Then after that, immediately we planted the implant fixture into the bone. And we use the same tooth of the patient, removing the root and then stick back into the teeth. So the patient, when he came and before he left, he actually looks the same. And now the teeth is no longer shaky and he has a very pleasing aesthetic, and yet he also have an implant inside. Now, if you look into this implant gum here, you notice that it's a little bit bluish black in color. That is because of the gum disease that the patient had. Now, 2 weeks later, when we review the patient, having taught him how to maintain the gum condition, you can now see that comparing with 2 weeks ago and then comparing to what he is 2 weeks later, you can see that the gum has actually regained back its normal gingival color, which is pinkish in nature, and also regained back its attached gingiva. Now, this procedure is still not the end yet. The implant fixture that is inside the gum takes 3 months to actually go through a gestation period. So we talked about that the implant fixture is biologically compatible material. So this implant fixture will then have to integrate with the stem cell within our bone marrow. And our stem cell will then form layers and layers and layers, encapsulating the implant and integrate it into a true bone cell. And this bone will then calcify to become a mature and a strong bone that can withstand the functional as well as natural anatomy and aesthetic for the patient. So 3 months later, then we will then use a laser detector, okay, a sensor that we sense the 3D orientations of this implant, and we then in the computer we design the natural aesthetic of the tooth, and finally we use a 3D printing technology to print out a biocompatible material which will then integrate with not only the bone but also with the gum soft tissue such that they look just like our mother nature. So this is the whole complete procedure of the modern implant technology. So therefore, from the conception, the design of the fixture, to the planning of the surgery and the surgical procedure, to finally design and the final delivery of crown, we can all do it very seamlessly. All right, so there many people will ask me, do we need to do bone graft? Yes, this one we need to look into the 3D planning, which I will explain it in the next video with you. All right, and then the next one is do we need to cut the gum and expose the bone? The answer is no, you don't need to. Nowadays, we can use the software to do a simulation surgery that everything is planned within the software, and what you see is what you get. And the software can do a simulation surgery such that we avoid all the what we call vital structure, for example, blood vessel, for example, nerve. And then we can place the implant very precisely into the position that we want it. And last but not least is it very painful? The answer is not at all. The whole procedure only needs to be performed using local anesthesia. Probably 1 cartridge should be more than enough. And then many patients will ask, if I go through the airport, the metal detector, will it sound an alarm? The answer is absolutely no. All right. So this is the first series that I explained to you the whole overall view of the new digital and AI technology on dental implant. And if you like it, then I hope you can click subscribe, share, and like, okay, and continue to support me. In the next series, I shall talk to you about how we measure whether a patient needs a bone graft or not. Thank you very much. Have a nice day.